The role of anger in emotional health and disease. Exploring the complex relationship between anger and its impact on emotional well-being and physical health, particularly in the context of Chinese medicine. Emotion and disease, a complex relationship. This presentation examines how emotion, particularly anger, contribute to physical health issues, emphasizing the Confucian perspective within Chinese medicine. It outlines the significant role emotions play in disease causation and the importance of understanding emotional state for holistic health. Understanding anger as an emotional cause. Anger disrupts qi flows. Anger is recognized in Chinese medicine as a primary emotional cause of disease, significantly influencing the flow of qi. When qi rebels, as indicated by the character ni, it can lead to various health issues. This rebellion is often seen as in disruption that challenges societal norms, reflecting its powerful nature. Physical symptoms of rebellious qi. The concept of rebellious qi emphasizes that anger can cause qi to move inappropriately, leading to a range of physical symptoms, particularly affecting the head and neck. Symptoms like headaches and facial redness are common manifestations of this disrupted flow. Overdiagnosis of anger in qi stagnation. Anger is often overdiagnosed in Chinese medicine as the sole emotional cause of qi stagnation. It is essential to consider other emotions like worry, sadness, and grief, which can also lead to qi stagnation in different organs, such as the lungs and the heart. Qi, the life force. Qi is the vital energy that flows through the body, essential for maintaining health. Its proper movement ensures balance and well-being, reflecting the harmony necessary in life. Rebellious qi is disruption of flow. Rebellious qi represented by the character ni signifies a disruption in qi's natural flow. This contrasts with shun, which symbolizes harmony and the correct, healthy direction of qi, emphasizing social conformity and balance. Anger's impact on qi and health. Anger disrupts qi movements. Symptoms localized in head. Bottled anger causes stagnation. Expressed anger raises liver yang. Differentiating causes of qi stagnation. Accurate diagnosis of qi stagnation requires careful consideration of various emotional factors. While anger is a common diagnosis, it is often overemphasized in traditional Chinese medicine. Emotions such as worry, sadness, guilt, and grief can also contribute to qi stagnation, potentially affecting not only the liver but also the lungs, heart, and spleen. Nouns approach in addressing this emotion is essential for effective treatment. Case study: misdiagnosis of anger. A 33-year-old woman experienced highlighting the complexity of emotional diagnosis in Chinese medicine. Patient background: a 33-year-old woman presented with physical symptoms including skin eruption, slight breathlessness, and abdominal distension alongside emotional distress from recent breakup. Therapist assessment. The therapist suggested that her symptoms were due to repressed anger, linked to past trauma, specifically sexual abuse experience in her youth. Diagnostic finding. Contrary to the initial assessment, diagnostic evaluation revealed to a weak lung pulse and sign of lung qi deficiency, indicating sadness and grief as a primarily emotional factor rather than anger. Conclusion of case. A case underscored the need for accurate emotional assessment in diagnosis, emphasizing that symptoms attributed to anger may stem from other emotions like sadness or grief. Understanding the broader interpretation of anger. So various forms of anger. Anger manifests in various forms such as resentments, frustration, irritation, rage, and indignation. Recognizing these forms is crucial to understanding their impact on mental and physical health. Consequences of bottled up anger. Bottled up anger often leads to emotional stagnation, causing physical symptoms such as headache, tension, and digestion. Issue. It's important to address underlying emotion to promote overall well-being. Anger masking effect. Anger can also mask other emotion like guilt or depression, which further complicates diagnosis and treatment. Understanding this interplay is essential for holistic health care. Anger as a mask for other emotion. Anger often masks deeper emotional states such as guilt and sadness. When individuals experience repressed anger, it can lead to significant emotional distress, which may manifest as depression. Understanding this connection is vital in diagnosing and treating emotional issues as the presentation of symptoms can be misleading. Emotional interplay and health implication. Conversely, feeling of guilt and sadness can trigger or intensify anger, creating a complex emotional interplay. This interaction may lead to various physical symptoms affecting not just the liver but also other organs like the heart and stomach. Recognizing the holistic influence of these emotions on health is essential in Chinese medicine. So, implication for treatment and diagnosis. Reevaluate anger's diagnostic role. Consider multiple emotional factors. Distinguish between qi stagnation causes. Assess emotional history thoroughly. Integrate holistic treatment approaches. Rethinking the role of anger in health. A comprehensive understanding of anger's multifaceted nature and its implication on health is essential. Recognizing the broader spectrum of emotion linked to qi stagnation can enhance diagnostic accuracy and treatment effectiveness. By moving beyond the overemphasis on anger, practitioners can consider additional emotional factors such as sadness, worry, and grief, leading to a more holistic approach in Chinese medicine.